The Matthew Forbes Romer Foundation would like to thank our major donors. And to welcome our guest tonight in celebration of gene therapy.
So, what exactly is gene therapy? First, let's start with the basics. This is a gene. Genes are made up of DNA, which are the blueprints to build the enzymes or proteins that do the work for your body. As far as we know, humans have between 20,000 and 25,000 genes. And most people have 2 copies of each gene inherited from each of our parents. They are the building blocks of our physical makeup, from the color of our hair, to our athletic abilities, to our immune system. But sometimes genes aren't built correctly. And a small adjustment to the DNA within our genes can change how our proteins work, which can affect how we breathe, walk, or digest food properly. Genes are like the blueprint to our body. Gene therapy can fill in some missing drawings. Gene therapy is the introduction, removal, or change in genetic material, specifically DNA or its molecule cousin, RNA, into the cells of a patient to repair or change a gene to treat a specific disease. The transferred genetic material then changes how a protein, or group of proteins, is produced by the cell. It can reduce levels of certain disease-causing proteins, increase production of disease-fighting proteins, or even produce new or modified proteins within the cell. A carrier, also known as a vector, helps deliver the gene. Typically, viruses are used as vectors because they've evolved to be very good at sneaking into and infecting cells. But in this case, their motive is to insert the gene, or genes, into the cell. The infectious part of a virus is removed, allowing it to still enter the cell's nucleus without making the patient sick.
The first patient to be treated with gene therapy was a 4-year-old girl treated at the National Institutes of Health's Clinical Center in 1990.
Our overall goal is, of course, that these are children that have a preservation of function that they go on to enjoy, that there's real quality of life.
Good job, Maggie.
We're in a position now in which we really can think of effective ways of curing these diseases.
I think that the research that the foundation is doing is the only glimmer of hope in this whole disease process. And although Vanessa's not any longer with us, I would love to never see another child go through what these children have to go through.
The 3 pillars of our mission are the research of treatments and cures, nursing and education, and screening and education. All 3 pillars have experienced significant results and accomplishments. Since the inception of our foundation, we have hosted 21 South Florida testing and education fairs and have screened more than 1,550 potential parents with as high as 50% detection in partnership with the Victor Center, J-Screen, and many other partners. Our education and testing fairs continue to be a great success. Working with South Florida universities, we have funded more than 35 nursing scholarships with Florida Atlantic University, Florida International University, and Nova Southeastern University, who helped conceive and implement nursing school training programs, lab simulation of in-home community-based family care, and maintaining quality of life through nursing. The last pillar is the research of treatments and cures. The Matthew Forbes Romer Foundation partnered with National Tay-Sachs and Allied Diseases to conceive and grow the National Research Initiative to 61 projects and many promising therapies. This has led to over $20 million in funding from the National Institutes of Health and similar institutions. We have helped establish the Tay-Sachs Gene Therapy Consortium and extraordinary efforts toward the clinical trials we are celebrating in 2019. Our first See the Light Award recipient is Jeffrey P. Castelli, Head of Gene Therapy at Amicus Therapeutics.
I've been following developments in gene therapy and its potential promise for many years, but it's always seemed to be 5 more years away from reaching its potential. But last year we started a project to look into the most promising new technologies for rare metabolic diseases, and as we started to really dig into this current generation of gene therapies, we saw several investigational ones that were demonstrating glimpses of really unprecedented potential in clinical trials.
In both kids, it's the heart that's the real threat to their lives.
How much more time do we have?
Megan, maybe a year. Patrick, less.
I wish that we had a drug to treat Pompeii, but we simply don't. I'm sorry.
Dr. Stonehill.
Yeah.
This is John Crowley. All the researchers out there say that you're a genius on the verge of a scientific breakthrough.
We are alive. We are strong.
Do you remember you told me that I should stop chasing miracles?
Well, don't get your hopes up, kid. Say Hail Mary.
Extraordinary Measures, starring Brendan Fraser and Harrison Ford, was based on the true story of John Crowley.
When we started the company, we decided the name would be Amicus Therapeutics. Amicus, the Latin for friend. We wanted this to be the most patient-centered and patient-focused company in all of biotechnology. This is a very unique company, I think, with that extraordinary focus on the lives, the spirit, the challenges of persons living with rare diseases. And ultimately, our duty as entrepreneurs in biotechnology is to develop the best medicines and get them to as many people living with rare diseases as quickly as we absolutely can.
Well, Amicus has been patient dedicated since its earliest days. I first joined the company in 2005 and have always found it extremely motivating and, importantly, educational to work closely with the patient organizations and disease communities. I think working with the groups like Matthew Forbes Romer Foundation and the National Tay-Sachs and Allied Diseases Association, these groups have such a wealth of disease knowledge, history, and expertise that it's really exciting to be working with them.
This is a group of people who have a range of experience with disease. They have a range of age and geography perspective, and they're able to give us their insights.
With our recent investment that we did with NCH and their intrathecal AAV gene therapy platform, we saw a real opportunity to take all of the work they had done applying this towards SMA and Batten's disease and leverage it as quickly as possible towards research in other severe neurological diseases like Tay-Sachs and others. As being part of the rare disease community, we try and make decisions around every drug development program as if we were a person living with that disease or caring for someone with that disease. Patients and their families provide us with inspiration, education, and really a moral compass for making medicines. We're committed to advancing world-class science that makes a meaningful difference in the lives of people living with rare metabolic diseases.
And importantly, never stop there, to keep pushing ideas.
Please give a big hand for Jeffrey P. Castelli of Amicus Therapeutics. Our second See the Light Award recipient is Dr. Terence Flott, a pioneer in gene therapies and dean at University of Massachusetts Medical School.
One of the things that's great about Terry Flott is that in every way, he's the physician's physician. For years now, he's seen the potential and the benefit of gene therapy at a time when it might have been in vogue and then out of vogue. But with steely determination and pristine science, worked to advance the field. Each and every day, this physician wakes up and makes a commitment to bring his science from the bench to the bedside, and often to help those who are neediest in our society, children with rare diseases who are, quite challenged.
I think foundations are so important that when I took over as the editor-in-chief at Human Gene Therapy, I started an article series and actually write-ups from various organizations. The foundations are the people who start up front and say, don't forget about our disease. And so the disease foundations make a huge impact in terms of advocacy and seed funding that gets people going on the track of working on that disease. While I had seen a lot of patients with other genetic conditions in my career as a pediatric pulmonologist, patients with CF that I knew that I would see often in the clinic and in the hospital who died of their disease. And it was awful. I mean, absolutely awful. For a long time, there were many people who were strong doubters about gene therapy. But we knew we had something special. We knew we were seeing some very dramatic, positive results. It was going to be a big deal clinically.
Axovant Sciences licensed the technology and started clinical trials in 2019.
This is the first time a child with Tay-Sachs disease has ever been administered gene therapy. At 3 months, there were no serious adverse events, and the gene therapy was generally well tolerated. Against a natural history backdrop of rapid disease progression, the patient also experienced no significant deterioration of their clinical condition on neurological exams or on MRI of the brain. At 3 months, the measured enzyme activity in CSF was more than threefold higher than the baseline pre-treatment. This positive result on a key biomarker gives us the confidence to move the program forward with the dosing of additional affected children later this year.
Researchers, staying grounded by being in touch with the patient's experience it's tremendously important. It just puts the whole context of the work in a completely different perspective.
When it was easy to kind of walk away from gene therapy research, Terry Flott, he exercised a commitment to stay at it and through really excellent science convince the world that this was the way to go. And now I love to watch that wry smile that comes on his face when he says, you know what, all these years was really pretty good.
Please give a big hand to Dr. Terence Flott for excellence in gene therapy.